Okay, let's get going. Welcome to the National Alopecia Areata Foundation's webinar, Integrative Medicine, What is it and how does it fit into alopecia areata treatment? Joining us today is dermatologist Dr. Peter Leo, Clinical Professor of Dermatology at the Icahn School of Medicine at Mount Sinai and Clinical Assistant Professor of Dermatology and Pediatrics at Northwestern University's Feinberg School of Medicine. And I'm Lisa Anderson, Senior Director of Research for NAF. Before we start the webinar, I'd like to cover a few housekeeping details. We have disabled chat for this webinar session. Please post any questions that you have for Dr. Leo in the Q&A section. Please keep in mind that if you keep your questions general, they will benefit the most of our audience. This webinar is being recorded. All registrants will receive a link to the recording via email. And finally, please share your feedback with us. At the conclusion of this webinar, a link to a short survey will pop up in your browser window. Please complete the survey there. This webinar is part of NAF's You Are Not Alone Education and Empowerment webinar series. NAF gratefully acknowledges the support provided for this webinar series by our partners Eli Lilly and Company, Pfizer, and Sun Pharma. Before we start today's webinar, I'd like to tell you a bit about NAF and our mission. The National Alopecia Areata Foundation is the leading advocacy organization for alopecia areata. NAF's mission is to support research to find a cure or acceptable treatment for alopecia areata, support those with the disease, and educate the public about alopecia areata. NAF's vision is an empowered community with a choice to embrace or live free of alopecia areata. To learn more about NAF's support resources and research and advocacy activities, or to join us as an advocate or a supporter, please visit our website at naf.org. And now on to today's webinar, Integrative Medicine, What is it and how does it fit into alopecia areata treatment? We're excited to have Dr. Peter Leo here with us today. Dr. Leo is a clinical professor of dermatology at the Icahn School of Medicine at Mount Sinai and a clinical assistant professor of dermatology and pediatrics at Northwestern University Feinberg School of Medicine. Dr. Leo received his medical degree from Harvard Medical School, completed his internship in pediatrics at Boston Children's Hospital, and his dermatology training at Harvard. While at Harvard, he also received formal training in acupuncture. Dr. Leo is the founding director of the Chicago Integrative Eczema Center and a founding partner of Medical Dermatology Associates of Chicago. He serves as a board member and scientific advisor for the National Eczema Association, and he is also a member of the American Academy of Dermatology's Atopic Dermatitis Expert Resource Group and a founding faculty member of the Integrative Dermatology Certificate Program. Dr. Leo, thank you so much for being here today. We're excited to have you here. I'm going to stop sharing and I will turn it over to you.
Thank you so much for having me, and thanks everybody for joining us tonight. We are going to talk about a really strange, but I think really fun area of medicine that has a huge impact on a lot of people, but sometimes is sort of brushed under the rug. Sometimes people do not like to talk about integrative medicine or alternative medicine or complementary medicine, but we're going to delve into it a little bit tonight, and I'm excited to do that with you. These are my disclosures. I get to work with lots of companies, but interestingly, this talk, we're not going to really talk about any conventional medicines because by definition, we're going to be going off the beaten track. So really, these aren't very relevant. The most interesting thing to me is that we live in a time of wonders and miracles, and we are seeing the most incredible advances in science and medicine that, arguably have ever happened in the history of our entire culture, that we've seen things that we've never seen before. But we understand that there is still a tremendous desire to look outside and to try different things. And we know that on the order of at least 50% of the patients will admit to being interested in or trying alternative and complementary treatments in a number of disease states. And I'm pretty sure this would include alopecia areata as well. My main focus is atopic dermatitis, and most of my patients come and see me because they really want to explore this. So that really brings up the question, if we have all these new amazing treatments that are so magical, why are people searching for these? What's the driving force or the root of this desire? And I think there are three big pieces. The first is when the conditions themselves are not curable. And unfortunately, that is true for a lot of the stuff we deal with. I mean, the part of the truth there is that a lot of the easy things that are curable, well, they're off the table. People fixed them. So, for example, strep throat is not a major focus of anybody's in the integrative and alternative world because we have a really good treatment. You can give somebody an antibiotic and typically it's treated and they're done. So it's sort of taken care of. But a lot of the things left over are the things that are not curable. For my world, atopic dermatitis, which causes a massive amount of itch and pain and suffering. Of course, alopecia areata and universalis and totalis, this whole family of this autoimmune diseases that cause a tremendous amount of suffering for patients and sometimes put people in a terrible position to have to choose treatments that are the next big point that are potentially unsafe or only symptomatic, only going to treat part of this and not get to that root cause. So we have this very delicate balance that I think drives a lot of patients and families to look outside. And then the middle point is also really important. I think our explanations sometimes are really unsatisfying. And I feel that way too. That's part of what started me on my own personal journey of becoming an acupuncturist and learning about different approaches to health and disease because, we have a lot of answers for things in Western medicine. We really do. We have lots of details. We know all about cytokines and receptors and neurons and all these different little very fine details. But then when you look at the other side of the tree, and you say, well, the big questions, what is actually causing this? Can this be prevented? Is there a potential for a cure? Well, a lot of times we're left with crickets. We don't have a lot of great answers. So it's this funny disconnect, tremendous amount of knowledge and information, but sometimes it doesn't connect up. And I think that also applies to the way we tell the story. When a patient says, why is this happening to me? What's going on here? What could I do to make this different or change the outcome? A lot of times we just don't know. And that's difficult. So I think this is part of what drives people to want to do alternatives. And this is part of why I'm so interested in it. Now, by definition, I'm interested in integrative, which means I'm going to try to bring the best from both worlds. I want alternative and complementary approaches, but I want to marry them with some of our conventional evidence based therapy. So sometimes patients come and say, I just want you for an acupuncturist. And I say, that's not really what I do, in part because I'm not good enough to be a great acupuncturist. I'm a very middling at best acupuncturist. So I'll say, if you really want acupuncture, I'm going to send you to someone who is an expert in that. And that's all they do. But what I'm trying to do is blend these things for my patients. And I think it's kind of interesting. When we think about alopecia areata, it is really a complex condition. And of course, it is not just as simple as hair loss, right? There are so many pieces. There are symptoms and sensations that happen in the skin. The skin can change itself. We can see there sometimes can be signs as well that can be scaling and oiliness. It can be red sometimes. We know that it's not just the skin, it can be the nails as well. We can see sometimes pitting, and sometimes even people have nail pain and discomfort from that. Of course, there's an enormous mental and emotional burden for this, right? We know that just the fact that even when the hair is there, people that have had intermittent loss are very worried that they're going to lose it again. They're constantly thinking about it. So anxiety, worry, stress. And of course, that in and of itself is affecting health, right? If you are worried about something and not sleeping because you're so stressed about something and anxious about it, of course it's going to affect you, right? It's sort of obvious, but that's why I'm so offended when an insurance company says, "Oh, it's a cosmetic thing." It's like, it's a cosmetic thing. This patient is really suffering. This is a huge burden. And then there are very, very practical things that can happen too. If you lose your eyelashes, well, your eyes are much more prone to getting irritated. If you lose the hairs in your nose, you can have nasal irritation. All these different pieces. If you lose, now I'm a bald man, so it's for me, it's not as dramatic or quick. My scalp is tougher, but if you lose your hair more quickly, you can get a sunburn on your scalp. That skin has not seen the sun, as with somebody who's had it over years, slowly has been able to develop that that ability to push back against the sun and be protected against sun damage. It also can affect things like thermoregulation, the ability for the body to maintain a good temperature because our hair plays a role. So all of these pieces, and you don't need me to tell you this, you know this, but I think it's so important that we think about how complex this is and how it really does affect the whole person. It's not just the hair, it's not just the skin. This is a bigger problem. And I think that to me means we have to think about it holistically. Of course, not only does it bring all these pieces by itself, but there are comorbidities. In other words, problems that happen alongside of alopecia areata and this family. Autoimmune conditions are more common. Things like rheumatoid arthritis, multiple sclerosis, diabetes, psoriasis, inflammatory bowel disease, and thyroid disease. All of these can come with this. more commonly. Of course, it doesn't mean everybody's going to have these things. It's not to be scary, but we know there often are suggestions that the immune system is kind of in a ramped up state and it's doing more of these things, or it's more likely to do this. Neuropsychiatric things like attention deficit disorder, even things like depression and anxiety, which can also be a chicken and egg thing because it's is it because this patient is being affected by this condition that they're feeling depressed and anxious? Yes. And could it be that there's some part of inflammation also driving depression and anxiety directly? Yes, probably. And then of course there's even cardiovascular heart issues that can be involved as well. Now, this is all against a backdrop of things like steroid phobia. People are very concerned about steroids, which we use a lot in dermatology, as you know, topical steroids, oral steroids, injectable steroids, all these steroids. And I think rightfully so. I still use them. I still think they're important, but I think we have to be careful. I think we've seen this amount of cavalier use that has caused some real trouble. So I have many patients who start my visit by saying, "Listen, I don't want any more steroids. I've used a lot. So please, can we do something besides steroids?" And you know what? I appreciate that. I hear you. I hear them. But that's not the only thing people are worried about. They're worried about other types of drugs that we put on the skin or in our bodies, like the calcineurin inhibitors. That would be tacrolimus or pimecrolimus. Antibiotics, we use those sometimes as an anti-inflammatory as well, or fighting infection. We know we have to be careful. We want to be good stewards. If we overuse antibiotics, we can get resistant bacteria that can cause all sorts of troubles. Sometimes it's just things like preservatives in the creams we're recommending or the products we're using. Sometimes it's just chemicals in general. And I really want to point out half of my practice is in kids. For kids, the threshold's even lower. We have to be extra careful with kids. So this cavalier kind of just try it. It's, just going to suppress your immune system for a while. I think we have to be respectful of that. And not every family or patient wants to do that. So for me, a big part of this is built in. Why integrative medicine? Why is it so important? Because part of it is something that nobody would say is alternative or complementary at all. It's very mainstream that we should be doing a shared decision making process between the provider and the patient and the family when appropriate. And we're going to work together. And that's why, like it or not, sometimes I talk to other dermatologists or other clinicians who really don't like this stuff at all, and they kind of turn up their nose and they're like, "Oh, it's a bunch of baloney, it's a bunch of really poor stuff with no good evidence." And I'm very intensely focused on those people because I say you might not like it, but our patients are going to ask about it. So if you decide just to deny it or not pay any attention to it, I think you could do a disservice. I think you have to know a little bit about it. So this is this idea though of being integrative, and I like the way that the National Center for Complementary and Integrative Health defines it. They say all involve bringing conventional and complementary approaches together in a coordinated way. And that's really what we're trying to do. We're trying to bring it together in a way that helps our patients. And of course, we're being paying attention to them. We're going to be really watching for changes and listening and making sure we're willing to make those changes and pull back if something's not working or change tack if something is. So that ability to really follow up tells us that nothing is forever. You're not signing on the dotted line, have to do this forever. We're going to try some stuff and see how it does. And one nice thing about a lot of the integrative treatments, which we'll talk about in just a moment, specifically, is that they tend to be safer. They tend to be easier to use. The other piece that I just want to point out, I think, is part of an integrative and a holistic care is thinking about psychosocial support, thinking about our cosmetic options. Like all of this is part of the plan. It doesn't mean we're going to be avoiding these things. So, can we integrate all of this together to make a really, I think, a holistic visit that covers all these pieces? Now, one thing I think is fascinating when I studied acupuncture was the language people use or the approach that they take to health and disease. And when you think about a lot of the conventional medicine, the terms that we use, it's very aggressive. It's warlike, bellicose. They'll say things like, we have to attack this. We got to kill the infection. We got to cut out the tumor. We got to suppress the immune system. It's really aggressive language. And when you hear other traditions talk, Ayurvedic medicine, traditional Chinese medicine, naturopaths, they talk differently. They use terms like balance, restore, strengthen, tonify, right? That sounds delightful. Who doesn't want to be tonified? That sounds wonderful, whatever that means. But to kind of put things back in a better order. And I like that idea. And I actually think that we should think that way a bit, and we should put our heads together that we can maybe do both. Sometimes we do have to calm down too much inflammation, but can we also bolster healing and bolster hair growth? Can we do both of those things at once to get a good balance? I think we can. I really do. And then there are haters who are going to hate, and you know what they say? They're like, "Well, just because it's natural doesn't mean it's safe." And we know that. That's true. Right. Some natural things are very dangerous. Sharks are natural, but you got to be careful. They can bite your leg off. So got to be really careful. Some herbs can cause all sorts of troubles. Some plant products can really cause things to be a mess. And then we also understand that not everything that seems like it comes from nature is natural. Like taking a whole handful of supplements, is that natural? I don't know. These don't grow in a meadow. They're not from a tree. This is maybe some guy in New Jersey put this together in his garage. It's hard to argue that it's natural, but there's probably a range. There's a spectrum of how we think about these things. So the hardest part is that there is a universe of possibility. And people will come in and say, "Well, have you heard about this? Have you heard about this? Have you tried this oil? Have you thought about this?" And the truth is, most of the time, the answer is no, I don't know. There's so much stuff. It almost is infinite. So we try to filter it down a little bit so we can guide a bit better. And the filters that I use are there has to be some evidence, right? Because if you look, so many plants have antioxidant activity and anti-inflammatory activity and antibacterial activity. I mean, there's tens of thousands of them. So we can't really use that. We need some clinical evidence. We need to see it in a trial of some sort. Now, it's never going to be as good as a drug trial. Those cost millions of dollars. And of course, they are paid for by selling a drug. And if there is no, unfortunately, no big olive oil or sunflower oil who's going to be able to fund these kinds of things to see if these things help. But we often do have some evidence in some studies that help us. We also have to have a sense of safety, and that can vary in this realm. But again, we have to be a little bit careful, and then it has to be practical, and that's huge too. So we can't recommend things that are totally impractical. The idea is to put together this multidisciplinary integrative toolbox using different treatments and sometimes even different experts. So I refer patients to dietitians, nutritionists, acupuncturists, hypnotherapists sometimes, all these different types of practitioners. We can work together, not all for the same patient necessarily, because that can be overwhelming, but with different scenarios can bring up different ideas. And one of the things that I use as my guiding light is what Paracelsus, who is one of the fathers of toxicology and balneology, which is the study of using spa therapy like bathing to help the skin, he says we should seek, knock, and find. Basically, go out there and start looking. Quit sitting around and waiting for it to come to you. And that's important. I try to keep learning, and every single day I learn something new. And many times I learn from my patients. So it's really been exciting. So let's start with a couple of practical things. Diet and supplements first. I think we understand, and I'll kind of zip through this quickly, but I just like to kind of paint a broader picture just so you see that it's not as simple as just give me the list of things that are going to work. I wish it were that easy. I wish I could just tell you, use this supplement, take this thing. It's not that easy. But when we think about diet and hair, we know the hair follicles are metabolically active. We know that calories and protein malnutrition and also certain nutrients, if you have a micronutrient, one of your main nutrients, if you're deficient, this can affect our hair growth. That's really important. A lot of different types of trace minerals then we have to make sure they're in the diet so that the hair grows. And we know that if you cut your calories or cut your carbohydrate intake quickly or change it, we can have a rapid hair loss, which can be very confusing. When we think about that hair follicle, it's very active metabolically. Those are all little blood vessels. There's tons of little capillaries around it. So it's very, very active. And I just put this in here because many patients will ask me, what should I be doing in terms of diet and supplements? Are there things that I should do? And the truth is, yes, to some degree there are. If you are deficient, it can really cause trouble. And we understand that things like a sudden weight loss or a stressor, including an illness, that's a stressor, that can actually lead to a very rapid hair loss shedding that we call telogen effluvium. Now, this is different than the autoimmune alopecia areata, but it's still really important. And sometimes we can see a little bit of both. Just the shock of the new disease can lead to a huge shedding of the hair. Things like niacin deficiency, and of course, that can lead to alopecia as well. And then there are a number of situations as well with hormones that can also affect the hair. Now, these are all different, but this is why ideally we want somebody who understands all these aspects when they're looking at it, because sometimes the diagnosis is not as simple as just one thing. There can be mixtures. Now, this is from a really neat study. They reviewed a bunch of different vitamins and minerals, and I'm just giving you the bottom line here for alopecia areata. And they talked about there is a correlation for low vitamin D. in alopecia areata. So I actually do recommend pretty much for all my patients with any inflammatory condition. So atopic dermatitis, psoriasis, alopecia areata, I like them to take a little bit of extra vitamin D. Now we can't go overboard because you can overdose on vitamin D, but taking one of the ones that's over the counter, typically for an adult, something like 4,000 international units per day would be great. For younger patients, we would decrease that dose. And of course, we want to talk to primary care to make sure there's no reason they shouldn't be doing that, but that really can be helpful. Same thing with iron deficiency. In some patients, it may just be coincidental, but there does seem to be a little bit of a connection with iron deficiency. So that's something else we might check and say, look, if you're a little bit deficient in iron, we want to give you some to help. One of the things that doesn't seem to matter, and this is important too, because not only is it trying to find things that might help, but things that maybe aren't a good use of our time, tons of over the counter hair growth supplements have biotin. And it turns out that biotin doesn't seem to have much evidence that it really helps with hair growth, particularly in alopecia areata. It probably doesn't do much. Now, we think that it can maybe have an effect if you're low. For sure, you start having some hair shedding, but adding extra doesn't seem to do much. It was kind of fascinating to see that. Now, folate and vitamin B12, that might have an effect in some patients, but very small studies, very limited data. Kind of interesting. So we can see there's some different things. And then zinc, some patients are a little bit lower in zinc. So it may help in certain patients. And again, it might be worth checking these levels. It may help them by giving them a little bit of extra zinc. Now, zinc is difficult because it can make people feel sick to their stomach. That's one of the problems. And I will point out that there can be toxicities from this. You can overdose, and we have to be careful. So sometimes patients are like, well, if some is good, more is better. Maybe I can just really take a bunch of everything. But iron can cause problems if you take too much. Zinc can make you, like I say, feel very sick, and it can affect your copper binding later if you take too much over too long of a period. Vitamin A can cause all sorts of troubles if you overdose. So we have to be careful. And that's just a little reminder. We don't, again, just because it's natural doesn't mean it's totally safe. And we want to be careful. So, uh, very recently, just in the past couple of years here, year and a half, we wrote this update on some of the different therapies for alopecia areata. And this is freely available, and we'll make sure you can get this reference, but it's online. You can read the whole thing. It's a dense read, but there's a lot of neat stuff in there. And we really tried to go through all of the published literature that we could find that's of a certain quality. You know, sometimes there's case reports or people just tell us something, but that's usually not enough for it to make it into something like this. We want a little bit more than that. And some of the things that we talked about in this paper, I think are worth thinking about is acupuncture. Acupuncture is fascinating within the context of its own model. The idea is that it can help restore the flow of this chi energy, this kind of life energy that's in our body, so that it flows correctly down the meridians again, because the idea is that it can become blocked or imbalanced. From a Western scientific standpoint, we can sort of apply a different filter over it, and we can maybe describe it in terms of affecting neurotransmitter release, which can have effect on pain and maybe have an effect on stress overall, and maybe some direct effect on the immune system too, which is kind of neat. Without getting too detailed, there are some really interesting changes and differences in points that are kind of historical or conventional acupuncture points. They actually are a little bit different than the surrounding areas, which is kind of neat. So there may be something to acupuncture, even from a very Western scientific standpoint. And this is sort of looking at a study where they were showing that the connective tissue is really altered for a very, very big distance. So you put a tiny little needle in the skin, we give it this little gentle twist, but it turns out that you actually affect this connective tissue going for a very, very long way away because it's all connected. And this helps us understand perhaps why there can be very distant effects. You know, you're like, shouldn't you be putting needles in my head? This is where I'm having the trouble, but not necessarily, because even putting them in an area somewhere else may be having connections and effects that are very distant to where they are. So the it's interesting conceptually, but fascinatingly, there really are no randomized controlled trials, right? And that's one of the highest levels of evidence. That's really what we're looking for. What that means is we have a group of patients that have alopecia areata and we split them up randomly. Some are going to get real acupuncture, some are going to get a pretend acupuncture, and nobody knows until the end. And that's really important because it's very easy, especially with things like acupuncture, which is doing a lot of things at once, but it can really affect the outcome. That placebo effect is real. And sometimes we can leverage that too. That even can help because at the end of the day, we want people better, right? So it's fascinating, but we don't have any randomized trials, but we do have some really, I think, pretty compelling case reports and case series. One patient with alopecia totalis for years, getting 70% regrowth after just about 3 or 4 months of acupuncture therapy. Now, one of the hardest parts is when we look at these studies that it's usually done in the context of other things. And this is one of the problems with integrative medicine, which again, I love and that's my practice, but it makes it really confusing, right? What do we always hear when you're doing a scientific experiment? Don't change more than one thing. If you change a bunch of things, how do you know what helped? And the answer is you don't. And that's part of the problem. So patients are often doing different things, but there may be a role or acupuncture. And I do recommend it sometimes, particularly if patients have skin sensations of itch or pain. Some of my patients do, or if they have a lot of stress, because I think acupuncture can be helpful for stress relief overall. And a lot of my patients report that they feel better and they do better overall. Very similar to that, hypnosis and mindfulness therapy can also help. We already mentioned that alopecia areata brings with it a whole bunch of psychological issues, anxiety, depression, a lot of issues that can also probably feed this whole fire and make things worse. And they did this study. This was a prospective study with patients that had long-standing severe alopecia areata, and they had them do 10 sessions of these 1 hour individualized hypnotherapy sessions over 6 months. And what was remarkable is after the sessions, the patients had improvement in anxiety and depression. They got significantly better in their sense of well being, their quality of life, including their dermatology quality of life, which is like a special scale, a special set of questions about how your skin or hair problem affects your life. And this was amazing. And the effects actually were maintained 6 months after the end of treatment. This was a durable effect even after. So, as you can imagine, I'm a big fan of hypnosis and mindfulness therapy. And sometimes patients are like, really, this sounds so dumb. Like you're just trying to make me feel better. And it's like, yes, but that's part of the secret, right? Feeling better. If you feel better and less stressed, your body heals more. Your immune system settles down. I know it sounds crazy, but let me flip it around. There are these beautiful studies that are absolutely frightening. They're terrifying, where they take healthy individuals, usually college students in these studies, and they basically put them under stress. Sometimes the stress is just making them stay up all night. Obviously, they sign a consent form there. They know what they're in for, and they usually get compensated. They have to stay up all night. When they then measure their blood the next morning, their skin barrier is damaged, it's off, their immune system is acting wonky. Like you can cause all of these issues with stress. So it follows that if we can help those things, we can get people better in some ways, which I think is pretty exciting. Now, if we look at some of the things we can do in the botanical realm, this paper I learned about when I was still in training. So, this is one of my teachers, Steve Gellis at Boston Children's. He taught me this years and years ago. And this is a paper from Dr. Hay. And this paper actually came out originally in 1998. It was a randomized, double blind, placebo controlled trial. So, this is the real deal. They did everything correctly. And they used this combination of some topical essential oils, and this included cedar, lavender, thyme, and rosemary, and it was within a carrier oil. And then they compared that just to the carrier oil by itself. So everybody was putting an oil on their hair, but it either had these other essential oils in there or it was just the carrier oil. And they actually found that the one that had the other ingredients in there, with the kind of what we think are the active ingredients here, it significantly decreased areas of hair loss. So it improved the hair loss at 3 months and 7 months. And they did this with photographs. This is for alopecia areata now, specifically in kids. And this p-value, this it really was quite significant, meaning when they look mathematically, they say, wow, this really seems like it was a real effect. It wasn't random chance. What I love about this was actually replicated. Somebody did this again a few years later, actually back in 2015, they did this, and they showed the same thing. So this is fantastic. Doing it once is great, and it suggests there may be something. Doing it twice is actually a big deal. So this work has been replicated, and this is something that I use a lot in my practice. And here it is. Here's the recipe. So we have it made for our patients already. It's a little cheaper. We have it made in kind of like small batches in Chicago, but anybody can get this. You can order it, you can make it yourself. That's the ingredients there right up top. And it's very, very safe. Now, are there any potential side effects? Yes, you could become allergic to one of these things and have an allergic reaction. Some people talk about if you use a lot of certain types of essential oils, lavender is one of them, that it can affect the hormones in your body, especially in a child. We don't think we're using nearly enough to cause trouble, but we don't know. So there is not 100% safe 100% of the time, but it seems pretty darn safe for most of the time. And I've used it for many years and it's really nice. Again, we're only using a few drops of oil, so 2 to 2 to 3 drops. We're going to massage it into the areas, scalp. It can be eyebrows. We don't want to get it in the eye. It would be uncomfortable, but you can certainly do eyebrows. And we let it sit for at least a few minutes, but a lot of people leave it on overnight. And sometimes you can even put like a warm towel over it, and that helps it soak in. And you do this as long as you need. It can take months, but it really can help. And I use this again as an adjunct. This isn't going to be the whole thing. It did help a small group of the patients. About 44% of the patients got better. Now, that still means the majority didn't. So, we have to take that with a grain of salt, but it really can be nice. And I had this funny case a few years ago, an older gentleman who was using it. He got so happy. He got full regrowth of his hair. And after it had been stable for many months, he said, can I get some more of this? I said, yes. I'm like, but if you want, you probably could take a break and see. I don't think you have to keep doing it forever. And he said, no, no. He's like, it's my night ritual. I love it. It helps me sleep. And that really stuck with me. I thought, maybe part of the reason this works is that it's very relaxing. But again, in the study, they really did compare it. The other group was doing the same thing, but with with the carrier oil, kind of just a plain oil, which is kind of fascinating and neat. Now, very recently, there has been some work on this kind of concept of onion juice. There may be something in onion, but this goes back quite a long way. So one of the earliest papers that was well done on this was back in 2002, so more than 20 years ago. And it was an 8-week study. It was single blinded, which means the patients knew what they had. I think it was too tough to mask the smell, but the people who were evaluating didn't know what they were using, and they were able to have patients take this kind of onion juice extract and put it on twice daily, and they did get a significant regrowth in their hair, and they saw it as early as week 2 in some patients. So just a couple of weeks of doing this, which is pretty amazing. So from this, there have been a number of different developments. In fact, there's a new treatment being studied right now that is looking to be one of the first botanicals. So it's all plant based that's going through the FDA for alopecia areata, which is kind of neat. And it's based in part on onion juice. It has other ingredients, but onion juice itself could potentially do this. Now, again, not entirely safe. First of all, it's stinky. Second of all, it can be extremely irritating to the skin, and it really could cause trouble for some people. It can be quite uncomfortable, but really interesting to think that this potentially could be helpful in some situations. Now, the other piece about onion juice, we don't fully understand how it's working, but one of the thoughts is that because it's a little bit irritating, it might be sort of irritating the immune system, kind of making it snap back into line by shocking it a little bit. So it might not be good to use this with something that's trying to also calm the immune system. It might be sort of canceling itself out. So, for example, a topical steroid, if we're going to put that on there, or if somebody's on a medicine that cools inflammation in the body, then doing something like this might actually not work with us. So, those are a couple of things I just wanted to point out. There is unfortunately not nearly as much as I would like there to be in this domain. When I really do the literature searches, a lot of it is very sparse. And I think this is partially a wake up call that we want more of this. We want to learn more about these types of things, what integrative approaches might be useful for our patients and for us as we're needing these things. In some, I think modern medicine, Western medicine is the best in a lot of ways, but in part it's because it's open, right? Because we're really trying to learn from other traditions. That's the big idea, at least. Doesn't always work out that way, but that's the idea, that we're willing to learn, willing to grow, and willing to try new things, sometimes even when we don't fully understand them, right? The mechanism of aspirin, it took a long time to figure out exactly what it is, and arguably we don't fully understand it even today. But when it first came out, people really didn't know how it worked, which is kind of fascinating. And importantly, I think we have to admit we don't have all the answers, and we're opening ourselves up to that fact, and the fact that we're here to continue to learn and grow. And in doing so, I think it really helps make that patient doctor connection stronger than ever. So I hope you enjoyed that little taste. I know that's tantalizing. There wasn't as much as maybe you hoped in there, but I'm glad we got to talk for a little bit about it. And I thank you so much for your attention.
Thank you, Dr. Leo. That was fascinating. I learned a lot, and great to hear your approach, which is not something that I know I personally haven't heard very often. So it was great to hear, all your personal experience, and great review of the literature that's available out there. So and you could see the reactions. Everybody is applauding and hearting you. That's wonderful. Folks online, please put your questions in the Q&A, and we will go through as many as we can. So let's just jump in here, and I will go down the list. The first person who wrote in said they'd like to hear your thoughts on low dose naltrexone for alopecia areata.
Low dose naltrexone is really interesting. So naltrexone is a medicine that is technically used when people have too much opioid. If you had a heroin overdose, or if somebody's in the hospital and they're getting a morphine drip and they get too much, naltrexone blocks that response. And it's an oral medicine. It's very safe. And its normal dose is between 50 and maybe 150 milligrams a day. But low dose naltrexone is usually down to 4.5 milligrams a day. So it's a tiny fraction, like a tenth or even less, 1.5 milligrams. Very, very safe. The most evidence for it really is in the lupus community. So patients with the systemic lupus autoimmune disease, and it does seem to help. There are other diseases that's been studied in. I think it potentially could help in alopecia areata, but I will tell you, we don't have, at least to my knowledge, any great studies that show that it does. Typically, if patients ask about it, I'm more than happy to let them try it. Very, very safe. It's a tiny amount. Sometimes it does cause very vivid dreams. So we have to be careful, sometimes nightmares too, but you got to be a little bit careful with that. But otherwise, quite safe. And I think it may be one of those things that can be a helpful adjunct for certain situations.
Right. That's really interesting. Is this, I think, came in during when you had your slide about all the comorbidities of alopecia areata. Is there an actual proven risk if you have severe alopecia areata to develop other autoimmune conditions?
I think it's an important question, and I think that as far as I understand it right now, these are just correlations. When they look at these populations, they say, "Boy, the levels, the risk of these other things is a little higher. We're seeing these at higher number." But I think for an individual patient, typically we don't really do a lot of stuff because I think those risks are actually quite low. They're higher than maybe the background rate, but not that high when you really look at a patient. So that's my sense right now. I don't usually do much more. Sometimes people that have really severe, I might check their thyroid once a year or have them do that when they're with their pediatrician. But I think, yeah, it may depend a little bit on the patient too.
Okay. About the supplements that you were talking about and where there's sometimes there are deficiencies, would you check blood, would you do blood tests first, like to screen for levels before recommending supplements?
Usually I don't, because here's the biggest problem. It's expensive to check them, and I've been burned many times. I mean, this is just like school of hard knocks. I take care of patients every day, and the hardest thing is a patient calls and says, "Dr. Leo, the tests we just did were not covered, and I just got a bill for $1,400." And after that's happened a couple times, you're like, "Uh-oh," you get a little gun shy because I can't know all the time. And that's the thing. Patients say, "Well, how much is it going to cost?" I'm like, "I don't know. I'm just going to send you to a lab." Like, I don't know. There's so many factors, and if in theory insurance will cover it. So I'm a little more gun shy about it nowadays, and I will often just start people on vitamin D, like we talked about, because I think that's something that most of us are relatively low in, especially in the Midwest here, where it's basically gray for months on end. So I think that's pretty safe. But if there's real concern, then I will do it. But I'll have that heart to heart with the patient, say, "Listen, I think we should do this because I'm concerned about it, but be aware." And might even have them go to like something like Quest Labs, where they can get a cash quote first before doing it. I mean, this is the weird part of modern healthcare. I never learned this. We didn't have to talk about this stuff in medical school, but now it's really important. I don't want someone to have a burden from a lab.
Right. Okay. Is there diminished or low to no efficacy of these alternative therapies like the essential oils or onion juice for alopecia universalis? And this person wrote, I tried rosemary oil early on during active shedding, and it seemed to flare my scalp to cause and thought thick, greasy yellow crusting and oozing.
Yeah, I think the truth is we just don't know enough about it. These studies typically are done in more mild cases. Sometimes they're chronic cases. We saw like the acupuncture. They were people that had more severe disease over a long period of time, but a lot of them aren't. And so we don't know. And of course, individual responses can vary. It sounds like you were doing maybe one of those oils. They were studied together. So again, it's like, which was there one oil that's better than the others? Would it work the same with one? We don't know. We're just not sure. But they were studied together, and maybe you even had a reaction to one, which is a problem too. That could happen to anybody. You could be allergic to one or more of them, and then the whole thing, all bets are off at that point.
Mm. Okay. Here's another question. What about fecal transplant? Do you know anything about that?
Yeah, so I wrote that paper. You might have seen it. I wrote a paper with Dr. Eugene Yen, who's a gastroenterologist who does a lot of fecal transplants. And we had a patient that got, so what does that mean? That means you take stool poop from a healthy person and you put it into a person that's having, in this case, they had ulcerative colitis. So they had the problems with their colon. And was remarkable is the healthy bacteria from the good poop actually helped not only their ulcerative colitis, but he started growing his hair back. which was really interesting. So I would say maybe we have very little evidence. It was sort of a neat report. That's why we couldn't believe it. We were like, wow, maybe there's something to this. So we wrote it up. I think maybe because we understand that the gut microbiome controls a lot of our immune system, and it's very much part of this whole story. So maybe, but I would say before you run out and do it, there's so many issues with it. It has its own set of risks. It's very expensive, and we don't really know. But yes, stay tuned for sure.
Okay. Research down the road. A couple of questions have come in about the essential oils recipe and MDA. So MDA is it practice?
That's my office. Yes.
Chicago. Okay. So folks who are in the Chicago area could potentially purchase it there. Is that what you wrote on your slide? And then you did have the recipe on the slide. And so people can make it themselves, or how else would they be able to do that?
Absolutely. You could order the ingredients, make it yourself. You could find if there's a shop in your city or town that works with essential oils, you could show it to them. And that's really all we have. We have a guy, his name, and you can even go to Ted directly. So there's a shop in Chicago. It's called Aroma Workshop Chicago. I don't have no connection with them except the owner is our friend, Ted Neenan. He's a wonderful guy. He's a perfumist by training. So he works with essential oils and things. And I showed him this almost 20 years ago. I said, Ted, can you make this for our patients? Can you make it a good quality one, keep the price low for them, and make it in small batches? And he's been doing that for us for more than a decade. He makes these, usually he'll send us 24 of them. And then if patients need them, they can pick them up. It's great. But you could even go directly to Ted if you're in Chicago, or call him. If you're out of Chicago, call Ted and he can make it for you. And he'll send it to you. And it's usually, it's less than $10 for the bottle, and that'll last you many months.
Great. Thank you. This person says they're new to the US from Australia. How does health insurance generally deal with integrative treatments when seeing a dermatologist?
They don't. Yeah, that's one of the hardest things. I don't know about Australia, but in Europe, there are certain types of alternative treatments that are covered. Of course, in France, even spa therapy, you can spend 3 weeks at the Aven or La Roche-Posay spa on the French government. That's part of your rights, which is amazing. We do not have that here in the good old US of A. So typically, these things are all out of pocket, which is why I'm so tuned into the cost. That's really important. So something that's $5 or $10, most patients can do that. Something that's $900, for extensive testing or supplements, God bless you if you can do it, but many of my patients, they can't do it. So I have to be very careful about that accessibility. My visits, though, I take insurance. And so I don't, there's no additional charge for that. I'm just integrating that as part of a regular visit. But it's true, many alternative practitioners, they do not accept insurance at all. And most of those people are going to be out of pocket, and that can get very expensive.
Okay, thank you. Please talk about connections between eczema and alopecia areata.
There are some. It turns out there is a connection. It is a small connection in my whole practice, and my practice is really dominated with severe atopic dermatitis patients. It's a tiny percentage, but I do have some people that have both, and that's kind of what sparked this whole concept that dupilumab, that biologic shot that helps for atopic dermatitis, it really does seem to help alopecia areata in some people. Really, people that have both. It seems to help. It's slow and steady, but the net effect really does seem to be positive. And then Emma Gutman in New York at Mount Sinai, she wrote a beautiful paper showing again, yes, there's something to this. It's just kind of slow. I want it to be faster. But what I like about the dupilumab is it's helping with the eczema, the atopic dermatitis, and it's really pretty safe. Some of the other medicines, the newer ones, which I do use, the JAK inhibitors, I'm so grateful to have them. It's the best thing in the world. It's like, I feel like a kid on his birthday opening up presents. We never had anything, but they have their own set of risks. And I have some families who are like, we're not ready for this yet. So I like the idea that dupilumab potentially could be useful for this. It's not approved for it though. So that's why it's for people with eczema. But then I say, if they have alopecia areata, I'm like, it might help with that too. Why don't we see what happens?
Yeah, great. So just an aside, there's clinical trials gearing up now for dupilumab and alopecia areata with Dr. Gutman, which you probably know. And Dr. Gutman did do a webinar on that topic for us back in October. So we have that recording on our website. If anybody wants to find that, I can point you to it. More questions about the oil treatment. Is it okay for a 2-year-old?
I'd be comfortable with it. Yes. With anything, try a small area first, and please don't overdo it, because again, too much essential oil, you'll hear, and your pediatrician might even call you out. You're using lavender. You got to be super careful. So you do, but if it's just 2 or 3 drops and massaging into the scalp, the absolute exposure is teeny, teeny, tiny. So it should be fine.
Okay, thank you. Do you have any information or experience with effects of food/gut connection, as in avoiding inflammatory foods, gluten, similar items?
Yes. So I do frequently recommend sort of an anti-inflammatory diet. The biggest thing for us, and this is more from my experience with atopic dermatitis with eczema, is many patients have tried very intense exclusion diets. And the number one thing you've kind of mentioned already is gluten and dairy. Those get blamed a lot. Eggs get blamed a lot. Sometimes nightshades like eggplant and tomatoes, those get blamed. So people cut them, and the classic thing we hear is, I was a little bit better when I did that. And it's always like, okay. But a lot of times, the reason they're telling me this is because it's really hard to keep those diets up. And for kids, it can actually be unhealthy. You have people on a very restricted diet. I've actually had pediatric patients who have stopped growing properly. They're falling off the growth curve. They're actually getting sick because they're not getting enough nutrients. So I'm very careful about exclusionary diets. That being said, though, I think a really helpful general place to start is looking at, it's called the AIP, and it stands for the Autoimmune Protocol. AIP diet. It's freely available. There's not a book or anything you have to buy. You can just Google it and you'll see it. And it really is just a way to eat more anti-inflammatory foods and avoid, relatively, it's not a strict exclusion, but you're trying to avoid the more pro-inflammatory foods. And honestly, it's kind of common sense. It's like, don't eat processed crap. Try to eat just very simple foods that our great grandparents would recognize as foods, right? Anything that's in a can or peeling off a plastic thing, you got to be a little careful. Why is it processed? And I do think it can make a small but a real improvement in overall health.
Okay, thank you. This person writes, in addition to acupuncture, which providers do you think would be appropriate to prioritize seeing? So you mentioned that sometimes you send folks to other kinds of providers.
In my experience, the acupuncturists are very helpful. I actually really do think the hypnotherapy, and I know it has a funny place in our culture that it's sometimes people think like, you think I'm crazy? No, but it's such a powerful thing. It engages the mind to relax and help the immune system calm down. So hypnotherapy is probably my favorite. And the person I refer to is all online. So I love that she can see them. It's very inexpensive for a couple of visits, and then she records it for them. So they have a recording and then they can play it back anytime they want, which is so cool. So it's just a few visits virtually. You don't have to go anywhere. And then you have a custom hypnosis script. It's sort of basically like a guided meditation, really. And if you didn't want to do that, you could probably find a good guided meditation online and do that and for free and just stick with it. But it's nice sometimes having a coach. That's the piece. That person will talk to you a little bit and help shape it and customize it to you for people that are having some trouble.
Okay, thank you. An Egyptian friend's mother told me that when she was growing up in Cairo, that a person's urine was used as a treatment for alopecia areata. Have you heard of this? Any thoughts?
I've not heard of it directly, but urine is used, it's in the old ancient medical text for a lot of different things. So it's one of those things that got thrown out there. My sense is nothing that I can imagine directly would make it helpful, but I don't know. I'm not that interested in pursuing that one, as I imagine many of our folks are not interested in putting urine on their scalp. But interesting, yeah.
Okay. Two questions here about JAK inhibitors. What's your opinion on the new drugs and their side effects? And there was a similar one. Do you have any info or opinions regarding this method for treatment?
So the JAK inhibitors are incredible. They've changed my whole career like that. We'd had nothing like this, right? And the fact that they've really done studies for alopecia areata is such a big deal. We've learned, I call it the virtuous cycle of drug development. We learn more about the disease, which gives us better drugs, and then we learn more about the disease from those drugs. We're just building. This is incredible. So
Mhm.
I think they're great. I think they're incredibly powerful. They have turned some of my patients around who really were struggling, so I'm so grateful for that. But yes, they do have a potential set of side effects that can be very off putting. The truth is, in my hands so far, thank goodness, knocking on wood, most of the patients have done great. So I think those they're very scary side effects, but I think they're relatively rare, especially in the right patient. So selecting the right patient who I think is going to do well on them, following up on the blood work, making sure everything's going well, following up on any side effects. But most of the patients I think that qualify for it, I think do really well. And I'm grateful for that.
Okay, thank you. Is minoxidil Rogaine useful?
Yeah, it probably is, but only once the hair starts growing. I think if you just put it on random people that haven't been treated in any other way, you probably won't see much effect because if the immune system is still attacking those follicles, probably not much is going to happen. But especially once things start growing, it probably can help make the hair grow faster, stronger, thicker. And there's no doubt when they do the studies or a couple studies that do show even just using it by itself helps. But I think that's because we know for some people they're going to go through phases. So if they get back into their growth phase, they're going to see it grow. So one of those things that definitely can help. probably can't really hurt if you're using it correctly. It's pretty safe and not too pricey. So a really good part of the puzzle for most patients. I think it's generally something we do add on.
And you're talking about topical minoxidil. Do you ever use low dose oral minoxidil?
Yeah, so that's the new hot thing now. In fact, it's been so hot in dermatology that we couldn't get it for a while. They actually like ran out of stock because I think the companies were like, who's using this? This is a heart medicine, but it's coming back. My honest opinion is that it is probably not that much better to do it orally. And even though it seems pretty safe, and all the studies right now saying, oh, it seems pretty, but I'm just like, I prefer not to use systemic treatments unless we have to. So unless there's some compelling reason to go to the oral one, I really try to stay topical. Maybe somebody with universalis, I would consider it, or if they've really failed the topical and want to try it, I think it's reasonable, but I still prefer to keep it simpler.
Okay. This person asks, do you recommend vitamin D3 or just in quotes, vitamin D supplementation? So is there a difference?
Typically, supplements are D3. Yeah, I can tell you the one I like a lot. There are many great brands. The one I tend to pick, and I have no connection with this brand in any way, shape, or form. But I asked a vitamin D expert like 10 years ago, which I was like, "Which one do you take?" And he's like, "I have no connection with them, but I'll tell you, the one's called Carlson Labs." And they're common. You can get them on Amazon. Carlson Labs. And the ones I personally take, they're called Solar Gems, and it's because they actually have omega fat in there, so that it helps absorb the vitamin D. I
Hmm.
take 4,000 international units per day as an adult. Now, again, for kids, we want to maybe go lower, but Carlson also makes some drops as well for the kids, which is really nice.
Okay, great. This person asked, do you know if alopecia areata causes eye problems? I seem to have bad dry eye since getting it, or maybe it's from JAK inhibitor treatment. This person is
Yeah,
wondering.
it certainly could be. So if you lose your lashes, then you actually are much more prone to dry, irritated eyes. That's absolutely possible. And maybe even if you didn't lose your lashes, you could potentially have inflammation around there that's driving it. We also know, again, with this kind of allergic correlation, you might have a little bit of just dry eye that's autoimmune. If your tear ducts become under attack, and that's part of one of the causes of dry eye, you actually get an autoimmune attack of your tear apparatus, and you don't make the same kind of tears. That's a possibility. So I do want to make sure you see a good eye doctor. I want to, get a formal diagnosis, let them really check. They can actually even measure your tears, your tear production to make sure, and they'll help you figure out what's going on and hopefully the right treatment.
Mhm. Okay. Do you recommend allergy testing? And this also says, or special diet. So you touched on this a little bit, but maybe that kind of is a, like allergy testing, gluten testing, that kind of thing.
Yeah, typically not. And sometimes patients are disappointed to hear that. They're like, why shouldn't we be checking? And it's sort of like the micronutrients too. It's like, it would be cool. And it's not to say that it's never the cause. Sometimes it is. It's just rare enough. And typically, this is not the way the allergic stuff is going to manifest, that you might find something, but it's probably not the highest yield. And it's not even like my first, second, or third things to work on. But many of my patients also have eczema or have food allergies. And of course, they've had a lot of allergy testing. So I've seen many, many patients over the years that have allergy testing, but typically they don't play a direct role. I'd say more of like an anti-inflammatory diet is probably a better bet. And of course, I mean, it is good to know if you think you're allergic to a food, you should get tested. If you say every time I eat this, I'm getting hives or swelling up or feeling really bad, I think it's worth looking into. But just for alopecia areata, it's probably not a very high yield thing. I don't think anyone would say you're stupid. I mean, you could do it. I just hate for people to waste time and money and hope. You're like, oh, maybe this will be something. And they're like, oh, it didn't show anything.
Yeah. Okay. And are there any treatments for brittle splitting nails?
So that's funny you say that because biotin, I was saying, doesn't seem to do much for alopecia areata, but that is the one thing that biotin really has been shown to do. There was this famous study where they did micrographs of the nails, and they were able to show when people took some biotin, their nails actually got thicker and stronger. So that could be something you could try for nail splitting.
Okay, great. I'm going to try to combine two questions because I think they're similar related. Have you heard of seasonal alopecia areata? My son's alopecia areata is triggered same time every year, then goes away, comes back same time next year. We don't know why. And then there's another one that says wondering, and that person was saying October, November. I don't know where they are located, but another person said wondering if we should move to a warm southern area uh for alopecia areata, not to trigger alopecia areata. Have you heard of this seasonal issue?
I have, and I think there are different reasons for it. So some people, it really is a climate thing, a cold shock, a hot shock. Sometimes there's something else that just happens to be seasonal as well, starting school or some point in school that can trigger it. So a stressful event that's part of it. Will moving help? Maybe. It's interesting. Many of my patients, and this is more for atopic dermatitis, they will move. And many of those patients have moved back. What they said is once things settled down, they're like, it seemed like it was good for the first months. But then once we got back to our routine, it went right back to where it was. So there sometimes can be this kind of false pause. I think when your body's a little bit under a change like that, it can freeze. But then once you're settled back in, but it sure would be interesting. I mean, if you really do think it's a climate thing, moving someplace warm, it potentially could help. It'd be really fascinating to see if that helped.
Okay. Does plum blossom acupuncture work for alopecia areata? What is
To
that?
my knowledge, and again, my knowledge is somewhat limited. Remember, I'm kind of a mediocre acupuncturist. Plum blossom hammer is like a little hammer that has these little pricks, and you go ding, 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 and you do that. It's typically not used for something like this, although it can be used for eczema sometimes to dispel extra heat. And that's metaphorical heat, like in the Chinese medicine sense, not in just a true thermal sense. But to my knowledge, I don't think it's used in that particular setup, but it could be in some. I mean, there's the cool thing about acupuncture is there are so many different styles and schools and approaches. And even for the same condition, there can be 25 different approaches because you're looking at the individual. So you might say, well, yeah, you're seeing the hair loss, but this patient has kidney yin deficiency and this patient has liver yang excess. So we're going to do different things, even though from a Western standpoint, you're calling them the same. They're not the same at all, which I really respect. It's kind of neat. It's much more individualized.
Okay, great. There's a number of questions about Ted in Chicago and his treatment. So perhaps if there's contact information, that's the oil person, maybe you can share that with me and we can include that on the email to everybody who's on today and who registered will get a copy of this presentation and the copy of the recording so you can dig in and rewatch it and see the slides in more detail. So we'll get that to everybody. I'm going to pick one or two more. We have lots of questions. Also, lots of questions about how to see you personally. I know you are listed in our Doctor Finder. How to see you as through as in an appointment in your practice. So that information is also on NAF's website. Okay. Are laser treatments safe?
It's a big question. So in general, yes, like most of the FDA cleared devices are safe. Lasers can be very safe, but there's so many of them, including things that we call ablative lasers, lasers that cut, actually burn little holes into the skin. So they are safe when used correctly by an experienced operator, but they can cause side effects, everything from burns to scarring to changes in pigmentation, so especially if they're used incorrectly. But as a general thing, I think yes, lasers are safe. Now, maybe you mean low level laser treatment, which is kind of a different set of things. And that one, the low level light or low level laser treatment, are very low energy things. They have like the helmets and things like that you can do. Those seem to be really quite safe. The only thing, just be careful around your eye because sometimes there is bright enough light that it could damage the eye if you're staring into it for a long period.
Okay. I don't want to name brand names, but do you have particular thoughts on specific supplements that are marketed as for hair?
Yeah. So, I mean, I think, there are a couple of big ones, but really those are more for pattern loss and they really are probably not appropriate for alopecia areata. So a lot of patients just kind of clump it together, and in fact, we see in the media and stuff when people are talking about it or kind of lay people in general, be like, oh, this person has the alopecia. But as a dermatologist, when I hear that, I'm like, what kind? Like that's a big thing. That's like saying they have a skin disease. It's like, tell me more. Like alopecia is a big category. It just means hair loss. Is it androgenetic alopecia? Is it folliculitis decalvans? Is it a scarring alopecia? Is it alopecia? We need to know. So yeah, those typically are not going to be helpful. I would say save your money for those.
That sounds like good advice, and I think that's a good place for us to wrap up. Thank you so much, Dr. Leo. It was fascinating. You answered so many questions, full tons of great information in this webinar, and we're grateful to you for sharing your knowledge with us. I will wrap it up by sharing my screen again and taking the audience through a few slides, but I just want to say thank you. Okay. Thank you to the audience also for being here today. We're so glad to have all of you and for asking all of your questions. So please share your feedback on today's webinar and help us plan for future presentations. A link to a short surveys will pop up in your browser window at the end of the webinar, and your feedback is greatly appreciated. Join us for our next webinar, Making Alopecia Areata Work at Work, My Personal Journey. Join award-winning career coach and best-selling author Joyelle Crawford for a candid webinar where she shares her personal journey of navigating alopecia areata in the workplace. Despite the challenges, she turned her diagnosis into an opportunity for growth and empowerment. In this session, Joyelle will discuss how she embraced her condition, adapted professionally, and thrived in her career. This webinar will take place on Wednesday, April 10th at 7 p.m. Eastern, 4 p.m. Pacific Time. Registration is now open at naf.org/webinars. And please come join us. Join us at NAF's 39th Annual Patient Conference. Registration for the conference is now open. The conference will be held June 27th through June 30th at the Hyatt Regency Washington on Capitol Hill in Washington, D.C. NAF's conference is the largest gathering of the alopecia areata community in the world, and you are invited. You can scan this QR code or visit naf.org/conference for more information. We hope you register today. And don't forget that NAF offers a number of resources and programs to the alopecia areata community, including support groups, our youth mentor and legislative liaison programs, the Doctor Finder, as well as news and webinar links and how to get involved. To learn more about NAF and the resources we offer, please visit naf.org or email us at support@naf.org. And this concludes today's webinar program. Thank you for joining us. We look forward to seeing you on the next webinar. Take care, everybody.